Thank y'all.
Hi, everybody. Thank you for taking the time to be part of our webinar today. As you know, the name of our webinar is Colorado CIL Network Resource Development. My name's Peter Pike. I work for the Office of Independent Living Services here in Colorado, which is part of the Division of Vocational Rehabilitation at the Colorado Department of Labor and Employment, and otherwise known as the designated state entity. So thank you very much for participating in our webinar. And we're going to start off by quickly introducing our panelists that we have on the call today. And so what I'm going to do is I'm just going to go ahead and ask Ty to say hello, tell us where he's from and what geographic area he sits in. And then we'll just kind of roll through these introductions pretty quickly.
Good morning or afternoon, everyone. My name is Ty Smith. I sit on I'm vice chair of the Colorado CIL, Statewide Independent Living Center. And I live in the Denver metro area. And I think that answers all of Peter's questions.
Thanks, Ty. Next, we're going to go to Rochelle.
Good afternoon. My name is Rochelle Miller. I'm the Executive Director for Connections for Independent Living, and we cover a 7-county area in northeastern Colorado that encompasses 13,286 square miles of almost all rural county area.
Thanks, Rochelle. Next, we'll go to Linda.
Good afternoon. My name is Linda Taylor. I'm the Executive Director at the Center for Independence in Grand Junction, Colorado. And we are covering 12 counties with 18,000 square miles of mountains and canyons. And as we say it, it's West Slope, Best Slope.
Oh, nice.
Thanks, Linda. Way to get us started. So next we're going to go to Ian.
Hi, my name is Ian Engel. I'm the Executive Director at the Northwest Colorado Center for Independence. We serve 5 counties, all rural and some frontier counties. They've been designated. We have square miles, and I don't know how many. And yes.
Thanks, Ian. And of course, Joan.
Hi, I'm Joan Labelle. I'm Executive Director of Disabled Resource Services. And we serve Jackson and Larimer counties, both of which are under fire right now, it seems to be.
Yes. All right. So those are your panelists. I'm going to ask to bring up the PowerPoint real quickly. And I'm just going to cover a few slides that we have here. You just heard from our panelists. And really the reason we're presenting this workshop is as a network, meaning the Colorado Silk, the designated state entity, and the Centers for Independent Living. Recently, we got together and submitted for a federal grant. And so what we want to do is sort of talk about what our experience was in applying for that grant and why we came together to do that as part of the Independent Living Network, and sort of give you that perspective and provide you a little bit of information about what we're doing today with this federal grant. So if we can go to the next slide. So we're happy to talk about that actually almost a year ago on September 29th, 2019, we were awarded a grant from the National Institute on Disability, Independent Living, and Rehabilitation Research, right? That is an administration on community living unit. So we're happy that we got that funding. It was a 5-year grant worth up to $2.3 million. And it is a research grant. And it's called Securing Employment and Economic Keys to Stability, otherwise called the SEEKS grant. And as part of the application process, we were able to pull together 17 letters of support for the application. 7 of those letters were from Centers for Independent Living. And of course, another letter was from the Colorado Silk. And it was very important part of the application that we were able to build that collaboration and get that going. On our next slide, you'll see that the SEEKS grant, the intent behind this research grant is to look at what are we going to learn from the intervention that we're testing that will lead to improving education and employment outcomes for people with disabilities, that will lead to increasing gross monthly income and decreasing social isolation, right? I'm sure those 3 themes aren't surprises to anybody. The research shows the impact on people with disabilities in those 3 areas, and our aim is to address and look for ways that we have evidence that shows it's going to improve those circumstances. The intervention that we're testing with the SEEKS grant simply is we're serving people who are applying for Social Security disability benefits while at the same time receiving services from an employment specialist to help them get into the workforce, and also working directly with a benefits counseling advocate so people can make an informed choice about the interaction around any benefits or public assistance they're receiving and making an informed choice about entering the workforce. And we're doing this through the Centers for Independent Living in partnership with the Colorado Division of Vocational Rehabilitation. So simply put, we're working with folks that the centers are serving to test an intervention around people making an informed choice about entering the workforce and looking at if there's a fit around applying for Social Security disability benefits. On the next slide, you're going to see some key elements about the SEEKS grant. Those key elements include, we have a SEEKS advisory team that consists of people with lived experience. It includes federal agency representation. It includes state agency representation, organizations like Social Security Administration, the Colorado Disability Determination Services. We've got service providers, nonprofit agencies, including the Centers for Independent Living, council representation from the Developmental Disabilities Council, the Silk, the Colorado Silk, that sort of thing. And what we're going to do through this grant is we're training Center for Independent Living staff to be serving the role of benefits counseling advocates and using practices based on the SSI, SSDI outreach, access, and recovery model and applying for Social Security disability benefits. We're having benefits counselors trained through Virginia Commonwealth University and Cornell University to deliver benefits counseling services. And then the employment specialist staff are trained in individual placement and supports model, which is an evidence-based model for people getting into the workforce. And those staff are also getting trained in customized employment. We do have contracts with Centers for Independent Living that are delivering the intervention. And one of the key elements of this grant is that the Centers for Independent Living will be vendors for the Division of Vocational Rehabilitation, who will be able to pay for benefits counseling services and employment services. And really, that's the sustainability of the effort. And so I just wanted to give you a brief overview of what the SEEKS grant is. There was one award in the nation, and we feel very fortunate that we were able to get that award. And that grant goes through September 2024. And with that said, we're going to shift next on the next slide to the panelist questions. We thought it would be important for folks to understand why the CIL got involved, why the Centers for Independent Living were part of the application process. And that's really what we're going to focus on the next 30 to 40 minutes. And then we're going to have an opportunity after that to open it up to the audience for any questions that you might have about how we put this collaborative together. So with that said, we're going to go ahead and go to the first question. And the question simply is, what's in it for me? As a Center for Independent Living Director, why did you decide to participate just beginning with the application of the federal grant? And so I'm going to go ahead and ask Joan to respond to this question, and then we'll go to Ian, and then I'll call out other names as we go. And each staff has about a minute to respond to this question.
Thanks, Peter. For me, as a Center for Independent Living Director, a lot of the calls that I saw that were coming through were just on this topic. And so the fact that this was getting us stronger buy-in from the Division of Vocational Rehabilitation and would have us being able to get those referrals, because even though we'd had a relationship with the Division of Vocational Rehabilitation and a strong relationship with the DSC, who the executive director of DVR is part of all of that, we still weren't able to get referrals like we wanted to, and how we knew we'd be able to collaborate with DVR. So this grant really I saw as a way to really build that collaboration stronger, especially with the buy-in from the top at DVR, that it would filter down through so that we could actually get some of those referrals and get some of our consumers the services that they were asking for. That was really one of my big reasons.
Thanks, Joan. Ian?
The reason that we got involved, I had been having a conversation within our organization, within our center, about, it really came back to the independent living philosophy about, okay, somebody comes in and says, oh, I hurt myself, I think I need a check from the government. So we're like, okay, so your goal is to rely on the government and live in poverty the rest of your life? And that's harsh, and we wouldn't actually say that to the person. But we're having this conversation in-house about how it doesn't really fit with our philosophy of independent living to support people to make informed choices and develop skills for living successfully in the community of choice if we're just assisting people to apply for benefits. We need to have the application for benefits be tied in with a larger goal of living independently, of knowing how to navigate benefits and what that means for if I want to be employed, and what are my options to access benefits as a first step, and then have that be a natural progression into exploring options around employment. And this was just a good fit for us around a conversation that we were already having about how we deliver these services and maintain integrity around the independent living philosophy.
Thanks, Ian. Next, I'd like to go to Linda Taylor.
We came in this in a little different way because CFI has been doing benefits counseling and employment services in tandem for several years. And when we started talking with Peter and the advisory team about what was inherently good about these relationships, was that we would be able to give options to people as we called them Plan A and Plan B. People coming in to ask about filing for disability services and, obtaining disability benefits, we called Plan A. Approaching them about being involved with the Division for Vocational Rehabilitation Services, or just be involved with our vocational specialist, was Plan B. And we wanted people to have a broad view that if one plan doesn't work out, the other plan is still in play and in place. we find it to be a very successful model for us. And we're happy to see that the state pursued this grant so that they could replicate this as a core, almost a core service for people, because we're finding that this network of supports and helps people in so many more ways than just either obtaining benefits or looking at careers. It builds stability into their lives.
Thank you, Linda. Next, we're going to go to Rochelle, and let me know if you need me to repeat the question, Rochelle, or if you got it.
I think I got it, but I would say that the Connections for Independent Living that I came into when the SEEKS grant was presented to us was in great tumult. And we actually decided to participate in the SEEKS grant for little bit more selfish reasons than just all of those that were so graciously given by my fellow presenters. Yes, our team actually decided upon this and decided on whether or not to participate as a whole. And that was done because at the time we were in quite a bit of turmoil. I was the interim director at the time, and there was very much upheaval from the last administration that had been in in charge. And we really looked at this project as, number one, all of the things that you've already heard for the consumers in our area, but secondly, as a really great way to rebuild the team that had been under some dire stress over the last few years. And that is exactly what has happened. It has actually been a great team building exercise for our internal team to work together. It has been a great exercise in rebuilding some of the fences and some of the relationships that we've had with DVR and some of our other vendors. And we did not have this program before. And so it has been an entire training opportunity for some staff members to embark upon and expand our independent living staff. And so it has just ticked so many boxes for us to be able to build internally some really great programs to be able to then actually develop and give out to the community. So it's been, like I said, a little bit of a more intrinsic type of value for us than it has been extrinsic at this time, but we definitely see it going to be fulfilling those extrinsic values as well in the future.
Thanks, Rochelle. We're going to go next. We're going to go to Ty, who's a Silk member. Hey, Ty, do you want to comment to this question?
I do, and I think a lot of what I was going to say has been said by other people, but the quality of life, I think, is really important, and that's why I got involved. For many of our peers out there, it's important to be able to find structure and a routine and build up social support networks. And this project has really had a good focus on quality of life for individuals that struggle with day-to-day living and struggle with the idea of work because of preconceived ideas of what they can and cannot do. So, I'm not a director of a CIL, but, to be able to help my peers and to be able to learn more has just been vitally important for me.
Hey, this is Kim. Can you repeat what the overall question is? There's a few that joined in late and they're not quite sure what the question was. Thank you.
So, Ty, I'm gonna, if you don't mind, I'll just step in here. The question that was presented to the panel is, what's in it for you? Why did you decide to participate in the planning process? And I probably should have said this from the beginning. It's not like we got together for one meeting. We had 2 months worth of meetings that was talking about what is the intervention, what's the design, and it wasn't something that was preset and just given to people. And we used this collaboration with the Silk, with the centers, to really formulate what the application was going to involve. So that was the question, what's in it for you? Thank you, Ty. We're going to go to the second question, and if I can ask for the second question slide to be brought up. And this one's a little bit more complicated question, but as a CIL director, you know, when you're thinking about participating in a grant application, what are some of the considerations that came across? How does this affect your infrastructure if you're going to present? Do you have the capacity within your existing resources or even the sustainability? And so I'm going to ask the Center for Independent Living directors to comment to that. And I'm going to go ahead and ask Linda to start us off on this question.
These come down to some hard choices at times. Three things I've been aware of as this SEEKS grant has gone forward. One is that the team has readily shared job descriptions and helped each other create the infrastructure, network that people need. The second thing is you have to make decisions about what staff programs you're developing and possibly what staff programs you're going to phase out. When we started this several years ago, we phased out a program. We phased out a recreation program we had in favor of doing disability benefits and kind of moving in this direction because we couldn't pay the same dollar twice. But the last thing is, I think that people are committed to good outcomes for their consumers in their areas, and this has really been very helpful to move that forward.
Thanks, Linda. Appreciate that. Let's go next to Rochelle.
Thanks, Peter. We really looked at this as an opportunity. We were understaffed at the time of the meetings that were taking place, and we knew that we were going to need to build staff up. And we really looked at this as a great way of intentionally building our infrastructure, knowing that we were going to need to bring some new independent living service members onto our staff, and then also knowing that some of our staff that had been with us for many years were really looking for something new to kind of dig their teeth or to sink their teeth into, and this was a really great opportunity for them to receive more training and be able to transition some of those new hires that we were bringing on in order to fulfill some of the duties that they were going to be leaving. And so it's been a very gradual, easy process for us to work through, and we've been really blessed to find some amazing new people to come onto our staff.
Thank you, Rochelle. Next, we're going to go to Ian.
Hi.
So we can take down the slide, and
you don't have to see me. I'm a little disheveled anyway. So the short answer to this question for my center, similarly to what Rochelle just said, is we did not have the capacity to support a full-on involvement in delivering benefits application assistance and helping people explore all the options around becoming employed and maintaining benefits, and that employment counseling piece and all the other pieces of it. What was nice about this project and the relationship we have with our designated state entity and how it came to fruition through applying for this grant is that it was very organic. So our center, like I said in response to the first question, was already discussing how we might build a program around supporting people to explore options for accessing benefits and becoming employed so that folks could make informed choices and develop skills around navigating those systems. And this was, as Peter alluded to, we had multiple conversations leading up to becoming involved. And as it played out, our center got to be, I don't know what the technical term is, but business as usual. So we are sort of the center that shows, okay, if we just keep doing things the way we are, here's our results. And how does that compare to a center that's got the support and the training to implement the intervention? What that did for us in addition is allowed our center to take a deliberate approach to getting training for our staff to build the capacity so that later, anticipating the results, to be honest, that I feel like the package deal is going to be more beneficial to the folks using our services, that we can be in a better position 3-4 years down the road to provide more quality and comprehensive services to our consumers.
Great, thanks, Ian. Joan?
So for us being involved way back in the beginning of it, we had a couple different terms, might be a little more complicated, and it is explained to us there was going to be tier 1 and tier 2s, and tier 1s were able to do, I'm going to use the business as usual and the intervention together. So that was one of the things that our organization, Disabled Resource Services, really had to look at the capacity. Which one could we be, a tier 1, tier 2? And so at the time, we were making some changes as well, wanting to build our employment program. And so we really fit into the tier 1 pretty well. And that was being able to do both business as usual, where I have staff that are just doing employment the way they've always done it, versus doing the intervention, which is this new way, the SEEKS way of doing some of the grant processes. So we had to determine, could we afford to do 2 more new staffs that were just dedicated to doing the intervention? And we were very lucky in that we had a board, I have a board that said, we're going to invest in this and we're going to use dollars that are from our unrestricted funds to be able to support the 2 positions. So we were very lucky that we were able to do both business as usual and the SEEKS grant control group and the intervention both at the same time. So for us, we were able to look at our infrastructure, add those pieces, and be able to do both at the same time.
Great, thanks, Joan. And so you've heard us get into a little bit of the details about the research project. At the very beginning, we talked about the project being a random assignment design project. So what that means is that as people come into the project, some people participate in one group that we call business as usual. So they get the services like anybody would through a Center for Independent Living. And then there's a second group of people that get the intervention that we're being tested. The intervention being tested is to work with staff that are at the same time applying for SSI, SSDI, while at the same time working with an employment specialist and also working with a benefits counselor. Like, that's the intervention that we're testing. And so I do want to comment, yes, like a control group, the business as usual is those individuals that would be considered in the control group. Good call. And I know some of you have put in some questions, and we're going to get to the answers of those questions a little bit later. And we've got 2 more questions for the panel that we're going to pose, and then we're going to open it up to the audience. And so if we can bring up the slide with the next question. So question 3, and think about these questions so far have been about sort of applying for the grant and what motivated the Centers for Independent Living to be engaged, what motivated the CILC to be engaged. And so this is another factor that Centers for Independent Living commented to is, how did your relationship with the Division of Vocational Rehabilitation affect your decision to participate just in the application for this grant? And so I'm going to go ahead and pose this question to Linda to get us started. And then we'll go to Rochelle after that. And we can take down the slide. Thank you.
Okay. I think our decision to be in, part of the early conversation was because we believe in the outcomes of approaching services holistically, and I think trusted that this would be a process that would, be fairly distributed and fairly used across the state. And again, if, you know, to look at the people who wrote letters of support, we wrote a letter of support. It was to say that we want to see this model played out in Colorado and be adopted, hopefully, by other states, so that these are services that are more integrated into independent living. I'm going to say business as usual. It is going to be business as usual.
Thank you, Linda. We'll go next to Rochelle.
So as you may have heard me allude to, our relationship with many of our partners that we would normally partner with as an independent living center were neglected, to say the least, or broken. And so the team thought that this was a great way of being able to rebuild those relationships that they knew that they needed to be able to help people and provide services for our consumers. But we knew that it was a great way to not have to build that bridge all by ourselves. And so this became a really wonderful vehicle for our agency to rebuild a somewhat broken relationship. And I don't think it was through any real fault of DVR. It was just kind of something that had tumbled apart while there were internal issues with our agency. And so this was a wonderful way for us to begin conversations again with them locally at a local level, and then actually be able to just understand how we could expand that outside of the parameters of this project. And that's been exactly what has happened. We're really pleased to see that. I think we probably mended that fence a little faster than we even anticipated. So that's been a really lovely side effect from participating in the program as well.
Awesome. Thanks, Rochelle. Next, we're going to go to Joan Labelle.
Well, I was excited about the prospects of this because even though, like I said before, we've had a good relationship, we didn't always get the referrals that we wanted to from, and frankly, that consumers wanted. There was a little bit of tension in that realm, and that they would try to work with DVR and not get the responses that they wanted. So I was really looking forward to that change, because within the grant itself, not only were the CILs being contracted to do that, the DVR counselors, the managers were really being told, you know, this is a buy-in that we're getting to. And so that there is, in essence, a greater contract even with DVR, with the Centers for Independent Living, and it was going to be a better relationship through the grant, because that was part of the reason for the grant. And so that was part of my excitement, to see that that relationship was going to be enhanced because of that, and actually be able to get the referrals, but also be able to work more collaboratively with Division of Vocational Rehabilitation.
Thanks, Joan. Ian?
So why the relationship with Division of Vocational Rehabilitation, for me, it has to do with promoting the independent living paradigm and an opportunity to raise awareness of how what we do can shift the paradigm, so that people with disabilities and users of these systems can make informed choices and develop skills to navigate the system. So to back it up a little bit, I don't want to be cured, and I don't want to be rehabilitated, and I don't want to be fixed, okay? I want the tools and the resources to live my life independently, participate in my local economy, and be engaged in my community. So this runs into like the medical model, the rehabilitation model. There's a little bit of a different flavor than there is to the independent living model. So my decision to participate in some ways was as part of an opportunity to infiltrate and infuse the independent living paradigm into how we work with DVR, and to really help create a more user-friendly system for the people the mutual people that we serve.
Awesome. Thanks, Ian. So we've got one more question for the panel, and then we're going to go ahead and open it up. And so as we bring up this question, it's important to understand we were awarded this grant a little bit over a year ago. And so even though it's taken a year, we're still pretty much at the beginning of just delivering the intervention. A lot of time has been spent on the planning, the implementation, and training of staff. And it takes a while to get things rolling. So we're just now beginning with the enrollment into the project. And so here's the question to each CIL director and to the SILC member. What is your current role with the SEEKS grant, your organization's role with the SEEKS grant, and how's it going? Joan, we're going to start with you.
So as I said before, we're a tier 1, which means we do both the control and the intervention. So we have at DRS, we have 4 staff who are just doing the business as usual, and then 2 staff that are doing the SEEKS, the benefits planning, as well as the employment specialist. So that's kind of our role right now, and how it's going. You know, the 4 staff doing business as usual are busier than ever still, and the 2 staff that are doing the SEEK are still getting up to speed with the training, as well as kind of the ever-changing things of a research grant, because as all of us know, that's written grants that work great on paper, but putting it in practice sometimes takes a little longer. So we're kind of going with the flow as changes occur and we have to shift kind of things. But they have enrolled people on both sides, both the business as well as the intervention. So that's pretty exciting.
Thanks, Joan. Ian?
Yes, our current role with the SEEKS grant is as a control group, the business as usual. And I feel like it's an important role. It's not just because we didn't have the capacity to jump into the intervention. It's an important role not only to show good results for the research project, but also to bring the integrity of what we do as business as usual, as a control group, maintaining that approach of options counseling to make informed choices, staying true to consumer choice, and seeing how these elements are important, and trying to represent what we've been doing for years, the integrity of what we've been doing for years with the independent living approach. And at the same time, we're able to use this opportunity, like I said, because it has been such an organic process that really incorporates the qualities of the different centers that are in different spots. I get to use some of the SEEKS funds that we are being contracted from our designated state entity to train my staff up on what's IPE stand for?
Individual placement in support.
Yes,
model.
And then we've got people SSI, SSDI, outreach, access, and recovery, SOAR trained, and we're also going to be able to get some more training for my employment staff, which will help us build toward where we want to be in the future.
Right. Thanks, Ian. Next, we're going to go to Linda.
Well, quite frankly, I'm kind of the odd man out because I'm not in the SEEKS grant. We couldn't set up a control nor an intervention because we are already in it, so we couldn't be used as a data source. So we're kind of set back and doing our own business. We have 5 people who are engaged in vocational support services and 5 people who are engaged in benefits, counseling, and assistance. So that's our business as usual right now.
Thanks, Linda. Next, we'll go to Rochelle, and then we'll go to Ty after Rochelle.
So I'm really glad to report that our team just took this on in every way possible, and they were just chomping at the bit to receive their training, to start recruiting. They became just really enthusiastic about the whole program, but that's really spilled over into other aspects of our independent living services and the services to our community. So our team members that are participating, we are a tier 1 agency like Joan's agency, in the same way that we're providing service and control. We currently have 3 people who are trained in SSI, SSDI, and SOAR in their respective areas, and 1 that is acting as the control. We may need to hire another person just to see what our capacity is, but we've also just received just great support within the community as soon as they found out that we would even be receiving this type of training and be able to provide these type of benefits to our consumers outside of the grant itself as well. That's been a really wonderful opportunity. But I have to say, for the team members who have been participating in it, they're thrilled with the process. They've been just kind of consuming everything as quickly as they possibly can on all of the information. So it's been just a wonderful learning opportunity and growth process for our team members. And I think we might have been the first ones to actually receive a candidate, but I'm not sure about that, but we were really proud if we were.
Yeah, so it is true, Rochelle, your organization and Disabled Resource Services about the same time were able to get folks involved with the study. So I just wanted to, that's the beauty of having different centers for independent living involved in the recruitment, right? We can.
And Rochelle and I aren't type A at all. Rochelle and I are totally opposites of everything like that.
Right. So I want to go to Ty, and Ty, as a Silk member, what's been your involvement with the grant to date?
Well, my primary role is being a representative to the CIL and the SEEKS Advisory Committee. So I sit on the SEEKS Advisory Committee as a peer. Because I sit on as a peer, we came up with the recommendation of having a peer committee that is made up with people with lived experience and all give input and feedback towards the committee on how to best word things, how to be culturally competent, how to address some of the fears and concerns that we may have, even if they're not true, but how to address them and recognize that they're there. One of the wonderful things is all of our peer voice is pretty much paid. So just like many of the professionals who are sitting in the room are paid for their time to sit on this advisory council, so are the peers who are using their expertise and their time to contribute equally to the grant. Finally, our peers lead by example. They had offered benefit counseling to our peer members, and I know at least I have accepted the benefit counseling, and in the process of learning a lot and working with benefit counselors so we can stay educated and informed in how to move forward. So that's just some of the roles and some of the things that I do, mostly as a peer, a person with lived experience.
Awesome. Thanks so much, Ty. So what I want to do is open it up to the questions. And I know that in the question and answer box, we got about 10 different questions at least that we want to take our time to respond to. I'm going to ask the panelists if they can to turn on their videos so that as these questions come up, I'm going to ask some of the panelists to respond to these questions. And
hey, this is Kim, the facilitator. We cannot have everybody turn on their cameras at once. I apologize for that, but that will make it crash. So if you can call upon whoever, that would be awesome.
Are you talking about panelists? Are you talking about panelists?
Thanks. thanks for that feedback. We'll work with you on that.
All right.
So
Do you want me to read the questions, or are you going to read them?
I'll go ahead and read them, and if I miss something, I want to make sure you help us fill it in. Is that all right?
Absolutely. This is Kim. That's fine with me.
Excellent. So we had a question from Julia, and it says, are all the counties in Colorado served by a CIL? And I'm going to go ahead and jump in and answer this question. And simply, the answer is yes. So we have 9 centers for independent living in Colorado, and there are 64 counties. And so each CIL has a catchment area with a couple of counties that are mutually served. So thanks for that question, Julia. The next question comes from an anonymous attendee, but as a SILC member, I wasn't aware of this possible research funding. Is it available each year? Is it a demonstration grant? And I'll go ahead and jump in, and then if Ty or Joan want to respond to this, by all means, you guys can chime in. But there are various research funding opportunities on an annual basis. And in particular, this one's through the Administration for Community Living. And if you took the time, there are other funding sources from other federal agencies as well where you can look this up. So in this particular case, you know, we got on the federal grants notification system, and that's how we became aware of this. And we would encourage folks to consider being on some of these federal grant announcement lists in order to see what funding opportunities are out there. As a SILC chair, Joan, or as Ty as a SILC member, do you guys have any other comments to that question?
Well, and this was headed up by the designated state entity who was able to apply at those times for the federal grant. They did it in collaboration with the statewide Independent Living Council and the 9 Centers for Independent Living. So we were the ones that wrote all the letters saying yes, we would be willing to participate. The SILC did it just as a resource across the board for all the centers. Obviously, we don't provide services, but we do provide that as a resource, and we wanted to show our support as part of the CIL network in Colorado.
Thanks, Joan. So the next question is from an anonymous attendee, but it's still an important question. Which entity is the fiscal agent for the grant? Is it a reimbursement or fee for service? And so keep in mind, this grant covers various expenses. So a big part of this grant, because it's a research grant, is working with an evaluator. So the Office of Independent Living Services is where the award came. And so we have contracts with different, in this case, an evaluator, but we also have 5 contracts with Centers for Independent Living. And the contracts are written in a way so that the Centers for Independent Living will bill us on a monthly basis based on how the contract's written. And I don't know if a CIL director wants to respond to that, or I'll open it up to Rochelle or Ian or Joan to respond to the question about how your contracts are reimbursed. Do you want me to respond? I'll complete it.
Well, we haven't gotten any money yet. We've got a contract signed, but we haven't seen any dollars, just because, again, how it works on paper as a grant doesn't always work out, so that we are looking at things that we can get. And it basically is kind of a reimbursement. If we, especially for things like equipment or staff time, things go out and then we get reimbursed for it. But it's separate from our Center for Independent Living contract. It's a totally different contract.
Right. That's a good answer, Joan. And so one of the key components to this grant is the contract was never intended to cover all the expenses of a Center for Independent Living. It really is written in a way that it's covering the expenses to help someone submit an SSI, SSDI application. That's primarily what the reimbursement is for. And we did that deliberately because the other expenses for providing employment services, for providing benefits counseling services, those are services as a vendor for the Division of Vocational Rehabilitation, you can get paid to provide. And quite simply, that's the sustainability of the intervention if we see it as success. It's getting payments through DVR. So this process was deliberate about how not only are we providing the services, but how can we sustain them? And I think that leads into the next question that we have from the Nevada Silk is, was it a very comprehensive process for the centers to become state vendors? And so I'm going to ask Rochelle to respond to that, or
Yeah, go ahead, Rochelle.
We had a really great support from Peter's office. One of the folks in his office was able to walk us through the entire process. We were not a current DVR vendor that had lapsed many years beforehand. And so some of the staff knew the nuances of it. So we didn't have a lot of catch up in that area, but we really did need to have some help administratively to walk through the process, and had it very smoothly done. And I think we were done with the process in, I would say, under 3 total weeks from start to application submission to approval.
So we've got about 5 minutes left for questions. And so I want to get to the next one because I think it's pretty important. And this is really what the intervention is testing. This person says, in my experience, I considered myself capable of working at least part-time while waiting on my Social Security disability application to go through. I was told by Social Security Administration and my attorney that I could not work at all during the application process. Have the rules changed? Was I misinformed? What's the panel's understanding with this regard?
Go ahead, Peter. You know.
So, Ian, why don't you go ahead and respond to this question?
False. A big part of this grant and the collaborative effort, what we're trying to do is destroy that myth, to be honest with you. And we've talked about this. We talked about this in the planning, and we talked about that it's important that we destroy this myth that you cannot work and keep your benefits. And I know I'm oversimplifying your question, but that's the basic concept. People are afraid to give up a guaranteed check for the government to take a risk on being employed, and we need to move past that. And it's not the truth. And it's a false pretense that keeps people from with disabilities from moving beyond being relegated to poverty just to have your basic needs met into being productive and proud, successful, contributing members of our communities. So, yeah, I mean, without getting into the details of the weeds on that, my understanding, and Peter, you can correct me if I'm wrong, is that's been a misconception for a long time now, that we really is part of the reason we're doing this.
Yes. So, Ian, that was a great answer. In fact, there's a lot more details around that question as to why an attorney might make that statement. And Social Security never says a person is unable to work. That is not a requirement. They use a term called substantial gainful activity. And as we're implementing the training the staff have to deliver these services, that's how people work with the consumers of the centers, is to help them understand an informed choice about going to work. So thanks very much for that question. We do have one more question, and then I'm going to turn things back over to our moderator.
The other thing, you're going to get told that stuff. People are going to get told that stuff, and it's important that we challenge it. Your county Your counties are going to tell you things, and don't take it. Don't believe everything that you're hearing just because somebody's got a title after their name. Get together, like Ty says, with your peers and explore your options and investigate it further. Sorry.
Thanks, Ian. And then the other question was a question about, well, when we're looking at the research project, how many people are required to be enrolled in the research project? And so you heard us talk about tier 1 sites. Those tier 1 sites have both the control group and the treatment group. Those tier 1 sites are, under our contract, are asked to enroll 50 people in the control group and 50 people in the treatment group. So it's 100 participants for those centers that are participating on the tier 1 side. For participants or for centers that are serving the tier 2 side, that means in Ian's case, he's just serving business as usual folks or the control group. He's going to be asked to enroll 50 individuals. And then we have another Center for Independent Living, Center Towards Self-Reliance, that's enrolling 50 people in his site. No, that's for the length of the project, the total length of the project. Those are the numbers. We, as a state, expect to enroll up to 500 people to participate in the study in order for us to get measurable results.
Over 5 years?
This is Kim.
Over 2 years, yes.
This is Kim Gibson, and we have 1 minute left for everything. So I want to thank you guys for this wonderful presentation. You should be able to find their emails on the agenda and the list of the topic of the workshop. And I want to remind everyone to fill out those evaluation forms. It's very important for us to get those feedback, so that we can ensure that we have successful future conferences.
Kim, our last slide has our contact. Did you want to put that up, Sarah or Kim?
And thank you everybody for the feedback on the chat and the participation as much as you were able. Really appreciate it.
Thank you to April for allowing us to provide this workshop. Thanks everybody, and thanks to the panelists. Thanks, Kim, for your work in moderating.
Anytime, you're welcome.
Good job, John.
And John.